you. Hi. All righty. So this is a very impromptu live. So if you have any questions, feel free to ask. Just not really basic questions like how to get started, because that you can find through my almost 13,000 videos now very easily. So hi Crystal, hi Jamie. Thank you for all the blue hearts. You know, that warms my heart. I love seeing blue hearts. Hi Trisha. Thank you for joining me. Okay, so March already. I would say this is the once a month live. I don't know yet. I don't know. I may go live again next week. I don't know. Don't hold me to it. Okay, so if you're here, great. Then you get me live right now. Hi Nina. Hi Nikki. Hi Raining. Hi Paul. Thank you so much. Marcus? Well, well, well. Look what the cat drew again. If it isn't JR. Well, is that what I have to do? Go live in order for you to show up? Deign us with your, deign to grace us with your presence. Is that what it is? JR? JR, I'm looking at you. Hi Jenny. Hi Katoya. All right. So I am going to be talking about, the thing I was thinking to talk about today was about the associations, AHIMA and AAPC. What are the differences? I think it's pretty clear, but for somebody that's brand new, it may not be very clear. I have done this video before, so if you want to check through the videos, totally can. I mean, you can even Google it, it'll come up too. Rating says, I need to know why people are saying that when taking, oh please, that's not you, right? You didn't ask me that question, did you? Because I ignored that question. Because of the simple fact that if they're going to say whatever they want to, okay, let's just get this out of the way then. First, I'll go with this one first. The Optum expert for physicians versus Optum expert for hospitals. All right, so here's the thing. When I give y'all advice, when I tell you this is what I recommend, this is what I recommend. If somebody else wants to tell you, oh no, you'll be at a disadvantage because that's what somebody else said. And I was like, are you freaking kidding me? In another group, because it was on my Facebook as well. I don't know if it was you or not, but somebody else said, oh, well, they'll be at a disadvantage if they have the physician expert for physicians Optum book, if they're taking the CCS. Listen to them, don't listen to them. Whatever. I gave you my opinion on why it was good and why I use it. To me, I have seen the expert for hospitals. I don't like the way that it's set up, and it is quite difficult to navigate, but if you want to use it, by all means, you go right ahead. But I'm not going to answer this question again, okay? So I'm going to make that very clear. It's very irritating when I get that question, because when I'm recommending something, it's because there's a reason for it. I'm not going to sit here and go back and forth with somebody that's saying, oh, well, I don't recommend that book, or you're at a disadvantage. Okay, please sit down, disadvantage. Okay, please. Because again, I took 2 certification exams in the same year, passed them both in the first try with that book, by the way. So if you want to go and follow somebody else's advice, you go right ahead. But do not, I'm going to make this very clear right now. Do not come on my channel. Do not go to my Facebook asking, well, I know Blue said, but can somebody please clarify this for me? Because that's going to piss me off like I am right now. Because if you're not going to take my advice, then don't take my advice. But don't sit here in front of my face and ask other people, oh, well, what do you think? I know Blue said this. Then go find your own channel to ask that question on. Don't come ask that question on mine. I'm just making that very clear. Hi, Jessica. Hi, Janiqua. Hi, Letty. I'm okay. I'm doing all right. Well, if that was you asking, I got you out of my group too, because I don't allow that. I'm just making that clear. Where are we going? Yes, JR, you are the cool one on Facebook. So let me get back to what are the differences between AHIMA and AAPC. So AHIMA is the American Health Information Management Association. They are a nonprofit organization, and they are the only medical coding association that has the degree designations for when you go through a approved CAHIM, the Commission on Accreditation for Health Informatics and Information Management. When you go through an approved program with them, you can sit for the RHIA, which is the Registered Health Information Administrator. That is if you get your bachelor's degree in health information management, or if you're going for your associate's degree, the RHIT, which is the Registered Health Information Technician. So AHIMA is the only one that offers those. AAPC does not offer those, okay? Somebody said, well, I can't find it on the AAPC website, and they were looking for the CCS on the AAPC website. Guys, they're two separate organizations, and their credentials are listed on their websites, okay? So you have to pay attention and make sure that when you're speaking because you know and you've done your research. When I get comments from people saying that they're sitting for the CPS exam, I said, we're not CPS, we're medical coders, okay? We are not CPS. Or somebody said that they were going to sit for the CCS or the CCSH. There is no such thing as a CCSH. You need to do do more research, because it's kind of ridiculous if you can't get it right, okay? Now, with AHIMA, they do have 3 medical coding certifications, okay? They have the CCA, which is a Certified Coding Associate. I had that for many years. It opened many doors for me because I did not allow people's ignorance to keep me from moving forward with that credential. However, there are certain things that you do have to put to bed once you start advancing in health information. And that was what I had to do. I did not want to, but I did. So that's a Certified Coding Associate. If you want to sit for that one, it just says that you have the entry-level competence to get into inpatient coding or outpatient coding. It's very simple, okay? Just very simple, straightforward. However, I will say that it is a tough exam. It is only 2 hours, but it packs a punch in those 2 hours. I'm just saying. So with that said, they have that credential, and you can apply for inpatient or outpatient coding. In the CCS, that is the gold standard of medical coding credentials. That is the advanced medical coding certification. I have that one. That says you have mastered inpatient and outpatient coding, and you can sit for it with the Optum ICD-10-CM expert for physicians. Is just as good. I can't believe I had to even say that. Anyway, the CCS, and you can make comments all you want to, I don't care. Because guys, it's very irritating to get those kind of comments, because when I get them and the person keeps following me everywhere, it's very annoying. So I'm showing my annoyance right now because of it. So anyway, the CCS, you can go anywhere. Now that one is required by a lot of employers because this says you have mastered inpatient and outpatient coding. So they could basically put you anywhere. So it is very highly sought after, in high demand and everything. Give me just 1 second. You know, when they have those little reaction bubble things, it gets in my way. Thank you. So anyway, when you have the CCS, you can go anywhere, okay? And you have a lot more opportunities because, again, it is highly respected. They're all really respected, but that one is the most because, again, it's the mastery. Now, the CCSP is the outpatient medical coding certification that says you've mastered outpatient coding, which means that you can code for ICD-10-CM, ICD-10, not ICD-10, CPT and HCPCS. You can code for all of those, and that's all outpatient coding. The CCSP is a certified coding specialist, physician-based. So you can sit for that one if you do not want to go with AAPC, okay? So, and because AAPC has a CPC, and I'll get into that in a minute. AHIMA does not require that you are a member of their association in order to carry their credentials. Now, AAPC, on the other hand, does. AAPC is a for-profit organization. They do require a $205 membership per year, every year that you hold your credential, okay? If you do not pay your membership fee, they will revoke your credential, okay? With AHIMA, I should say that for the medical coding certifications, if you hold one, okay, if you only hold one, it is 20. Okay, so if you have the CCS, CCA, or the CCSP, if you only hold one, it is 20 CEUs for your reporting period. Okay, so basically like 10 CEUs per year. Okay, if you want to go that way. But if you have the degrees, it's 30 CEUs for your reporting period. So just so you know. Okay, now with AAPC, they do have their flagship credential, which is the CPC, the Certified Professional Coder. If you do not have experience in medical coding at all, they will require you to carry an apprentice status. So that's with the A, it'll be -A. Now, there's nothing wrong with it. I am a resume writer. I've helped many people get jobs, even with the apprentice status. But some people will say, well, no, I don't want to put that because they're not going to hire me. They're going to find out anyway that you're an apprentice because they have to make sure that they verify your credential. So they're going to find out that you're an apprentice anyway. So with that said, you want to make sure that when you are deciding which way to go, keep that cost in mind. It's an added cost. And not only that, it is 36 continuing education units for one credential with AAPC. Now, AAPC is the American Academy of Professional Coders, and they are a for-profit organization. So their business model looks a little different from AHIMA. Okay, AHIMA again is nonprofit, not for profit, and then AAPC is a for-profit organization. So 36 continuing education units for one certification. Now, they do like to encourage their people to get a whole plethora of credentials that they do have available on their website. Now, I have said this many, many times. If you're brand new, all you need is one. And stick with one for the first 2 years because it's already enough that you have to pay all these fees and trying to maintain your credential and get your 36 continuing education units if you're going to go with them. But if you end up going with them and you say, well, you know, I want to get the CPMA next. Okay, CPMA is a certified professional medical auditor, right? And they require specific vendor credentials, CEUs, in order to maintain that credential. That means that you cannot go willy-nilly and find free CEUs to cover you for that credential. You can't. So with that said, just remember this. When you are brand new and you have no experience to back you up, adding on additional credentials like the CPMA, which just means that you took a test, you memorized a few things, and then you passed. That does not a professional medical auditor make, okay? So you want to make sure that when you're getting additional credentials, it's because you have experience or you've had time in that you understand what's going on. It's even harder for you, it's going to be even harder for you if you're brand new trying to get this credential because somebody told you you need it. You don't need it because guess what? When you're being tested for the CPC, they're testing you on every single subject, okay? Reimbursement, all of the chapters in the CPT book and E&M and all of these things, they're testing you on all of these elements. So you're already saying that you're competent when you get the one certification. And again, you don't need it. It's not going to make you more money. And never once have I seen a job listing say candidate must have multiple credentials to get this job. Never once. So just saying, keep a little bit more money in your pocket and think about every time you add on a credential. Because again, these vendors, these specific vendors that give the CEUs based on whatever you need for that CPMA, they can charge you whatever they want to. And if you don't have a job yet, that can get really expensive really fast. Okay, so I'm just saying, slow down when you're brand new. It's enough, right, to learn about medical terminology and anatomy and all these things. But it's quite another thing when you're sitting there trying to get all these other CEUs for a subject that you don't have any experience in. I'm just saying. All right, what did I miss? Baj, if you are asking that question, you need to go back to the guidelines. Hi, Carrie. Congratulations. That is so awesome. Carrie passed the CCS. All right. Lots of congratulations. Hi, Alexandria. All right. That's awesome, Allison. Allison also passed the CCS. Very cool. Very, very cool. All right. I like when people encourage each other. That's really awesome. See, look at all these people asking for you, JR. Yep, $210. Yep, that's a lot of money. Alexandria says, I'm with AAPC, and I wish I had known more about AHIMA because the A's are annoying. But everyone, including my instructors, acted like AAPC was all there was. And sometimes that's all they know. You know, when I first got here to my forever home, my boss, who's not my boss anymore, but she had started with AAPC, and none of the girls were certified. That's how the story goes. None of the girls were certified. So because none of them were certified, she wanted to make sure that everybody got certified because it was very important, okay? And so she made all of them go through the AAPC program because that's what she knew. And so everybody there, when I got to my hospital, was all AAPC because everybody had sat and passed through that program and sat and passed for the exam. So because of that, you know, they're all AAPC, and I was like the outlier because I'm with AHIMA. And they were like, well, Blue, don't you want to be like us? You know, don't you want to get a CPC? I'm like, why? When I already have at the time I had the CCA. I said, this says I can do inpatient and outpatient coding. If I just have the CPC, then I would have to only say that I know outpatient coding. And when I took that test and when I had that credential first, it was all ICD-9. So there's a difference, you know, big difference in ICD-9 and ICD-10, just saying. Let's see. Indeed, JR says, at least AHIMA separates their A's. Ha ha ha. Thank you, Letty, so much. Yes, do not ask a stupid question on my live show. Hello, Cardenas. So, and the only reason that JR said that is because, well, okay, so this person had chased me, sent me an email, sent me a post on Facebook, and the post was about which book, because they had heard that, you know, you would be at a disadvantage for using the Optum ICD-10-CM expert for physicians. I like that one. That's the one. I'm not paid by Optum, but that's the one that I've used. That's the one I have recommended. That's the one I recommend to the people who ask me, and they've done quite well. Several people have passed because they got that book. And then this knucklehead comes along and says, oh, well, I was in another group and they were saying I would be at a disadvantage. I know Blue has said that I should get the Optum expert for physicians, but I don't know now. I'm so confused. No, you're not confused. You want to sit here and go back and forth and argue about which book is which when I'm experienced. I have 15 plus years of experience already, and some knucklehead in some group that you were in is giving you some other thing to think about. Okay, and you want to get all wrapped up in that? No, ma'am. You have no business on my Facebook or on my channel or anywhere on any of my social medias. That's it. That's the end of the story. End of story. That's That's awesome, Roxanne. Carmen says, I went to school with DeVry, and the one that you use is the one that they recommend as well. Why are these guys triggering Bleu? I have no idea. Paul says, this is great, but unfortunately I have to bounce. Bye-bye. I appreciate everything you do. Thank you so much. Yeah. Oh, really? Oh, it's a good thing. Good thing you told me that, JR. I appreciate that, because again, off of my thing. So I have about another 20 minutes because I have an appointment at 8:30. So I still have 20 minutes to go. Yes. So does anybody else have anything that they want to talk about? So basically that's the difference between AHIMA and AAPC. Basically, it is going to be the cost, the overall cost that you're going to have. Now, AHIMA does have a membership. Again, it's not required. And if you don't get the membership, you still have to pay a separate fee for reporting your CEUs. That's just the cost of doing business. And it's normal. I mean, it's not going to be $205 a year. So, it's still a reasonable cost if you're looking to save some money. And if you're thinking that, oh, well, I should go with AAPC because it's easier. Trust me, I've had plenty of people that have said, Bleu, I failed that test 4 or 5 times at the CPC exam. And they have to take it again and again because they let their nerves get to them, or they don't study enough. And so that's the thing, so you can't really believe what you hear when you hear people say, oh, the AAPC exam is easier. No, it's not. The CPC exam is not easier. You have just as much odds of failing either way you go. Okay. And so that's just the thing. And if you want to look in your area to see what it is what credentials that they're looking for, they still ask for all of the medical coding certifications, even though people say, well, I don't see them asking for the CCA. That is not true. Sometimes people are just looking for medical coder when they're looking for a job, and not medical records technician. They're not looking under like revenue cycle technician and that kind of thing. So there's just a bunch of different names that they use for coders. And so sometimes that's when you'll see more of the CCAs pop up as well. So there's really kind of no difference either way you go. But if you're taking the CCA or the CCS, both of these are going to require you to know ICD-10-CM, ICD-10-PCS, and CPT. So that's just what you have to know there. Now the CCA, out of all the medical coding certifications, CCS, the CPC, the CCSP, the CCA has the most unique domains. Okay. Now AAPC has theirs broken down by subject, but again, it's all CPT stuff, majority of it. But when you're talking about like unique domains, the CCA has the most unique domains because they have to test them on everything. So, I mean, it just really depends on where you want to go and which way you want to go. But either way, just start with one. I had the CCA and I did very well with it. I've been very successful with it. That's the credential that I used to launch my YouTube channel in 2018. So, it's nothing that you can't do with it. I'm just saying, except for like move up to like leadership positions, but that's understood. That's an understood part of it. Thank you, Alexandria. Teresa says, what is the latest with AHIMA and their CEU change that they wanted to implement? So for the last thing that I heard, Ms. Teresa, I heard that it wasn't going to be until 2025 that they were going to require that 40% of the CEUs have to come from AHIMA. There's still a debate going on about that. So there's really nothing set in stone yet from what I'm understanding. But from what I understand, that they were pushing back the implementation until 2025, but they're still in talks about it. Now, why is this such a hot button topic? They're saying 40% of the CEUs have to come directly from AHIMA or AHIMA products. So this means that if you are a member, the free CEUs that you get covers that 40%. So you see how they kind of did that there? If you're not a member and you go to an AHIMA conference, well, you get plenty of CEUs that way, and you can definitely get all the CEUs that you need and meet that 40% requirement. but they're just saying that it has to be AHIMA or AHIMA products. So that's the thing that they want to make clear. Um, if it wasn't like that, it could be whatever CEUs that you find that are, you know, applicable to medical coding, obviously. But if you get CEUs that are approved by AAPC, which I do all the time, my facility, we get CEUs every single month. We get one CEU every single month because we have to sit through coder education. Excuse me. And these are all approved through AAPC, approved for one CEU through AAPC. And I still get to report those to AHIMA because AHIMA does accept AAPC CEUs. So that's the difference right there. And I guess AHIMA just wants to make sure that, you know, they're saying the reason that they're saying it is because they want to make sure that the quality of education is there. But then people were saying, well, if you want quality of education, then give us more options because the website only gives you so many options and then that's it. And some of it is not really relevant to what a lot of people really do need. Okay. And so that's where there's a big hubbub about that. And it's understandable because if you're going to have to spend money on these things, you want to make sure that you're getting your money's worth and not that you're just getting anything willy-nilly because again, you have to give us updated options. I wish that they would give us more updated options instead of talking about like AI. I understand AI is a big thing, but at the same time too, there's still a lot of errors with it and people are still freaking out. Oh, it's going to take over. AI is another tool, just like the encoder is another tool, just like the electronic health record is another tool. It's not taking over because again, there's so many words that have different meanings and it depends on the context, and then it has to be able to understand like what it's saying. That's why we have critical thinking as human beings, and this is why I tell you guys, you have to work on your critical thinking. If you do not work on your critical thinking and you're so busy on TikTok and doing all these things and getting these little short things that's making your brain just get that hit of dopamine, right? And when you're looking at these little TikToks and it's just like little 10-second things, you're not giving your brain enough time to process. Your brain needs time to process beginning, a middle, and an ending. That's why you will see all of my videos are at least 20 minutes, okay? 18 minutes is technically a short video for me, but all my videos are long form because of this reason. Because when I tried to speed it up, because in the beginning when people would tell me, oh, Bleu, your videos are too long. You should make them like 8 minutes. So I tried to do 8 minutes. And then I found that people were having even more questions and they were getting even more confused. So I said, you know what? Mess on this. I'm not going to do that. I'm going to do it the way that I want to do it. And if people want to speed up the sound of my voice, you can totally speed up the sound of my voice. That's totally your option. That's why YouTube has that feature where you can speed up the sound, you know, one and a half or two, you know, but it's entirely up to you. But again, you have to have the beginning, the middle, and the end. Now, when I was coming up, going to school and everything, I wasn't sitting here in kindergarten with an iPad or anything like that. I was sitting there with actually a book. And so there's a big difference in how children are being taught versus how people, when I grew up, how we learned and how we have a little bit more patience, right? But it's really easy to start losing that patience to learn if everything is just instant. You know, kids today don't understand what the Dewey Decimal System is. They don't know, a lot of them can't read cursive writing because unfortunately the schools stopped teaching it. And when you stop teaching that, now you're just doing everything is in print and people are not engaging that part of their brain, which helps them to learn and helps them to retain. There's a lot of things that are going on right now with education, unfortunately, that I really wish people would just kind of slow down and pick up a book. But I still get a lot of people who say, I hate books. I hate books. How can you hate books and want to be in this industry? You have to like books, you know? I mean, it don't have to be your most favorite thing in the world, but it does help, you know, because books are big. Yes, you see all of my books back here. And that's not all of them, okay? But they're very useful and it gives your eyes a break from the blue light too. I'm just saying, you know. Let's see. What did I miss? So hopefully that answers your question, Miss Teresa. Carmen says, I appreciate you. Really answered so many questions I had. You're welcome. Do you get questions about NCCI all the time? But NCCI is a National Correct Coding Initiative, and that's more about like, just being mindful of what codes are going together and what codes can't go together. So there's times when some people might try to put two procedure codes together, but those don't go together, or it might need a modifier, and the NCCI talks about that. Basically, it's like putting an emphasis on correct coding. Just saying. Shamika says, hello, Blue. I use the same book as you used in my current medical coding position. The CPC exam was challenging, but I passed at 90% on the first try. That is awesome. That is really awesome. You see, using the ICD-10 CM expert for physicians, I'm just saying, I'm going to get it into a shirt with a big old heart on it. Take that. So, JR says, congratulations, everybody. That's awesome. Where are we at? Cardenas says, I'm looking for a self-study. Where exactly do I start and how? Jessica, thank you so much for answering that. I work better with a book. That's what I say. Books are full of goodies. They are. I love coding books. Absolutely, Jamie. Absolutely. JR says, no more cursive writing. I hate people who hate books. Book that. That's funny. Yes, exactly. Thank you all so much for your help on that one and answering that one. But when you start getting into studying medical coding, whether you get the workbooks and you go from there, it's all about being organized with your time, taking one subject at a time and not trying to overwhelm yourself. I've done so many videos talking about like the steps and how to get started and going through all of those and the timeline and the syllabus and everything. I've already done that, so you can check the description box. Not this video because it's a live video, but any of my other videos that you go to my page and you can see it says independent study and it'll go through the whole thing. But this is a great field to learn. It's a great field to grow in. And always know that even though you have a lot of experience and you have a lot of knowledge, there will still be people who will try, who will try you. So you always want to make sure that you have your references and resources. Coding Clinic, CPT Assistant. Those are great resources. And sometimes those can be misinterpreted by people. So really make sure that when you're citing a reference that you really do understand what you're saying and that you always code correctly. If somebody is giving you bad advice, you really kind of want to talk it out before you just disregard, because sometimes you may not understand it and somebody else having experience may see it a different way. And then if you two talk it out, then maybe you could see it how they see it. But if it is absolutely like the person's all the way to the left and you are all the way over here this way, then you might want to find somebody to ask about that, because like the question from earlier was, how do you code for fractures? That should not even be a question. That should not even be a question at all, especially if you already have your certification. And it should not be a question if you are a student either, because that's why you read the coding guidelines. I always talk about reading the coding guidelines once per week in their entirety. The ICD-10-CM official guidelines for coding and reporting. The 2024 version can be found for free from CMS, and all you have to do is Google and let your fingers do the walking, so. Jamie says, they help in so many ways. Books are so much better than Google search. Yes, it is way better than Google search sometimes. Sometimes Google can give you a lot of really good information, but I hate it when I ask Google a question that says like, what is this, what is that, or whatever, and it'll give me pictures. It says, here's some pictures. No, I don't want pictures. And that's another thing with how people are learning. Everything is like pictures, Instagram, hieroglyphics, that's what it is. And to me, I don't want pictures. I want words. I need words. because that's just, it's better for me. It's how I learn, you know. And I think that um, people have to make sure that they are doing the old ways of learning, even though they say, oh well, it's so easy to just look it up on the internet. You know, what if you don't have the internet? You don't want to be totally lost. It's like when people tell me that they can't even read a map. You know, back in my phone book days, and I'll say this before I go because I got 5 minutes. In my phone book days, when I used to deliver phone books with my mom, um, we had to use a map book, and they called them Mapsco. That was the book. And so every gas station had a Mapsco. They had a whole like display case of magazines and Mapscos. So if you were on the road and you needed to have a map, they had the little foldy ones, but they had a Mapsco. So Mapsco was like a book, but basically you had the index and then you had the like the map, and each map was like in a grid. And then you could see like the specific streets, and you could like, okay, this is where I gotta go, this is where I gotta turn. So we had, my mom and I had quite a few of those Mapscos when we were out there delivering phone books, because like you go into the neighborhoods and stuff. And again, we didn't have GPS. We didn't have, you know, all of these things. People had cell phones, but it was like there was not a lot of cell phones at the time. My mom had one because that's how much business we did with the phone books, you know. And so she had one. She was one of the rare people who actually had a cell phone at the time, and it was a big cell phone, but you know, we still used it to get around. But it did not have GPS. It did not have any of those things. It was just so that we could call, you know, and talk. And before that, it was beepers. Does anybody remember having a beeper? I remember having a beeper. I had a pink beeper, and then when that one broke, I got a blue beeper. It was like a clear, clear case, pink beeper at first, and then a blue beeper. And so we had our beeper plans, and then of course cell phones came out, and then my mom had like the Nokia phone, and so and then it was a flip phone, and then it was a slide up phone, and yeah, we had all those. So, but you know, now if I mention Mapsco to anybody, you know, around me, young people, they're like, "What's that?" And I'm like, I bet you wouldn't be able to know how to read a map, you know, and that's bad because, again, what if you need to read a map? You know, I'm just saying, something you all should think about. M says, is it possible to pass a CPC without going to school and just doing the lessons alone? Yes. JR says, books don't emulate blue light. Correct. And then he says, word. Jessica says, and it's so easy to get it wrong going the easy way too. Correct. JR says, yes, maps are important. Without them, you have to phone it in. There you go. Crystal says, I remember having to look at the street signs and the map on trips growing up. There you go. See? Triptychs. Oh my gosh. That's a blast from the past. I used to love getting those from AAA. You could go to AAA and get your triptych. So you would tell them where you're going, and they would map it out for you, and they'd give you like this little flip thing, and it would tell you like all along the way. Like if you told them that you wanted to see like certain stops or monuments or whatever, they would like figure that in and tell you exactly where to go, and you could follow that triptych, and that was your triptych there and your triptych back. I love those things. I have let my AAA membership go a long time ago. I need to get it again. But that was one of the things I loved. That was really cool. I remember those. Thanks for the memory, Allison. That's funny. Humble says, I haven't seen a payphone in 20 years. You know, I haven't either. I have not either. JR says, I had a beeper, the 90s. Yes. I think by far my most favorite years of the 90s was 1997 and 1998. 1997, 1998. Two of the best years ever. I will say that. That's cool. Are you trying to be cute, Em? Because we just went over that. JR says they have emergency phones on the Bay Bridge tunnel. Well, I mean, yeah, I've seen those. But you know what I thought was weird, and I'm gonna say this last thing. When I was in Michigan a few years ago, um, everybody here, if you are gonna pay for gas, you have to prepay your gas. In Michigan, I don't know if they do it now, like you have to prepay, but in Michigan, when I went up there, you could just pump your gas and then go in and pay. I was like, because I was trying to prepay, and they were like, "Oh no, you pump your gas." Because I had went up to the Upper Peninsula, and they go, "No, you pump your gas, and then you come in and pay." I go, "Really?" And they're like, "Yeah," and like, go, "You're not from here, are you?" I said, "No, I'm from Texas, and we don't do that. You have to prepay." And they go, "Yeah, it should be that way here, but it's not that way." I was like, "Wow," it's like going back in time. That's funny. Okay, so just watch from the beginning, and you'll see I was talking about the difference. Well, you might have to speed up like the first 5 minutes because I was annoyed, and then I was talking about books, and then after that is when I get into it. So just kind of skip over the first 5 minutes, so that way you don't have to hear me ranting. But anyway, I gotta go, guys, because now I got a meeting. So I will see y'all next time. Bye.